Non-union, FDA definition 9 months. Uh, Clinically, a progressive sign of healing for 3 consecutive months. 3 out of the 4 cortices should unite radiologically. Clinically, the patient should not have any tenderness. Patient's fracture healing factors affecting local systemic, local is soft tissue, bone loss, infection, type of bone like distal radius or tibia, amount of displacement, comminution, inadequate stabilization, mechanical issues of fracture fixation method and application, systematic diabetes mellitus, nutritional deficiency, renal problems, high creatinine, uh, smoking, uh, medications like bisphosphonates, quinolone, steroids, NSAIDs. Type of union: hypertrophic, atrophic, infected, hypertrophic, elephant foot, horse hoof, atrophic, inadequate blood supply, sclerotic, infected, always rule out in any case. Nonunion classification: tibia, Pale et al. A less than 1 centimeter loss, B more than 1 centimeter loss. Type A less than 1 centimeter, A1 lax, A2 stiff. Stiff is again classified with deformity or without deformity. Type B is more than 1 centimeter, bone loss with no shortening, with shortening but no gap, with gap and shortening. Treatment for tibia: dynamization, exchange nail, bigger nail, fibular osteotomy is usually not required, reaming generate autograft. Exogen, low intensity pulse ultrasound, accelerate fracture healing, application for 20 minutes a day, NICE approved in UK for treatment for non-union more than 9 months. In long bones, infected non-union, radical debridement, bony stabilization, dead space management, mescole technique, soft tissue addressing by VAC therapy,